welcome to Health Talk. My name is Carrie, and today we're here with Mary Faye, a registered dietitian and certified diabetes educator. Hi Mary, how are you?
I'm good, Carrie. How are you?
Good. Today's topic is going to be diabetes management. On our previous segment on diabetes, you mentioned about the triangle of management. What did you mean by that?
Well, in managing diabetes, the easiest way to remember the most important components of management are to use a figure of a triangle. And the 3 points of a triangle that are important are diet or meal planning, physical activity, and medications, if the medications are necessary. If you're balancing all of those and then monitoring blood glucose, you're doing a very good job of reaching the goals that we want. And that includes many of the topics we'll talk about today, but controlling diet and weight, managing physical activity so that you are expending calories and the other benefits of physical activity, and then taking medications properly.
Well, what are the target blood glucose values?
Well, and the target blood glucose values, which is our key of knowing when a patient is managing their diabetes, are those that we ask them to look for not only long-term but short-term. The long-term blood glucose value that the physician will take is called a hemoglobin A1C. And the target value for that, recognized by all of the professional organizations for our diabetes patients, is a number that's less than 7%. Normal values are 4 to 6, but when we can have our patients reach less than 7%, that is what is the goal. The other values, though, that a patient needs to know are what are called blood glucose testing results. And at home, they can prick their finger and get a value. The target blood glucose goals pre-meal are 70 to 130, and post-meal, 1.5 to 2 hours after a meal, is less than 180. Now, some of the diabetes centers in the country, the premier diabetes centers such as Joslin, actually recommends 160 or less, because we're finding that if someone is running at 180, they still are running the risk of damaging parts of their body. So 180 or 160, depending on what the physician recommends. So when a patient is doing their finger prick and they see a value of 200, they know something went awry. And there are many factors that can affect that blood glucose. But a patient will ask me if the A1C is all the number they should look at. But the hemoglobin A1C is an average blood glucose over the past 2.5 months. And it's measured because glucose attaches to the red blood cell in the body, and our red blood cells live for 90 days in our body. So that gives a patient an average. The finger prick tells them throughout the day how they're managing pre and post meal. If the A1C comes in at, say, 6.2, you would think, oh, the patient is doing really well. But if they are running very low blood glucose at a particular time of day, say a 40, and running a high of 200, that may average out to an A1C of 6.2, but you know from your daily finger pokes that's not what we want. So you have to, we encourage the patient to use both data points.
Is a meal plan important no matter what type of diabetes?
Yes, meal plans are the cornerstone of therapy for those with diabetes. I mentioned physical activity, medications, and diet, but no matter whether you have type 1, type 2, gestational diabetes, or diabetes that has been caused by another factor, whether it's medications or a disease process, diet is the cornerstone. And that is the most important critical part. Not that the others aren't important, but if you are taking your medications and being physically active but not watching what you're eating, you will not be successful in controlling that blood glucose.
And what are the basic guidelines of a meal plan?
Number 1 is to have 3 meals a day. I often have patients who say, well, I skip breakfast, I eat a light lunch, and then I eat a really big supper. And the goal with having 3 meals a day is to help the body by giving it a little bit of food and carbohydrate through the day to help balance that blood glucose. The other is, as I mentioned, not skipping meals, The other are the right portions and the right kinds of foods. We discourage those foods that are what are called high glycemic index, meaning that they will raise the blood sugar. The other important components we educate our patients on are increasing fiber in the diet and limiting the fats, because those with diabetes, as we'll talk about in our show on complications, are at 3 to 4 times the risk for heart disease. And we encourage them to choose the right kinds of fats and limit those. Portions are another problem. We Americans have supersized everything, and so we have to reteach what is a portion. Now, if orange juice is a 4-ounce glass, not a 16-ounce glass. So we teach that. So those are pretty much the key components of a good meal plan.
Can you explain more about the term carbohydrate counting? And what foods are considered carbohydrates?
Carbohydrate counting is the method that we teach patients how to control and count the number of carbohydrates in their meal plan, since it is carbohydrates that affect the blood glucose level in our meals. There are 3 components in food that provide calories: carbohydrates, proteins, and fats. Proteins would be meats, eggs, cheese, nuts. Fats would be salad dressing, margarine, butter, those items that don't affect the blood sugar directly. So we talk about them because we need those in our diet for a well-balanced, nutritious diet, but we focus on carbohydrates because they are the component in food that raise the blood glucose. So carbohydrates include starches, pastas and potatoes and breads, whole grain muffins, tortillas, ice cream, desserts, brownies, fruits, and milk. And I often have patients who are very surprised that milk and fruit are included in the carbohydrate list. They are nutritious, and all of those whole grains are nutritious, but they are carbohydrates. So carbohydrate counting, we teach them how to read a food label. And on the graphic, you'll see that on a food label, total carbohydrate is the number that we tell them to look at, not sugars. You'll see that it is a subcategory of total carbohydrates on the label, but it's the grams of carbohydrate that we want them to look at. And we teach them that 1 carbohydrate choice is equal to 15 grams. So if, for example, a woman usually is allowed to have 3 to 4 carbohydrate choices at a meal, which means she can have 15, 30, 45 to 60 grams of carbohydrate at a meal. So that would be, for example, at lunch, a sandwich, 2 slices of bread would be counted as a carbohydrate, a glass of milk, 8 ounces of milk, and a serving of fruit. So that would count. Then in carbohydrate counting, we also teach them about low, I call it rabbit food, low carbohydrate vegetables such as the spinach, salads, beets, carrots that are very good for them, that they can have a large amount of and included in their diet.
Are there any foods a person with diabetes should not eat?
We now teach patients how to fit desserts in. In the old days, we never even gave them a list of how to have a birthday cake or brownie or ice cream. Well, guess what? They ate it anyway. So now we teach them that pretty much any food can be included in a meal plan with moderation. So we do teach them portion sizes for brownies, cookies, ice cream. Not that we want them to have that as a mainstay of their meal, but that it certainly can be included.
Now, exercise has many benefits. Can you explain why physical activity is so important for a person with diabetes?
Well, physical activity is important for anyone, for good heart health, lung health, bone health, also for weight management. In addition to those benefits for someone with diabetes, is it also helps the insulin, which is the hormone in the body that helps control blood glucose, work better in the body. It makes every cell receptor, a little complicated, but every cell in your body has to use insulin. And when you exercise, insulin is more efficiently used at every cell site. So in addition to those benefits of decreasing risk for heart disease and the benefits to the body, and weight control, which is very important for those with diabetes. Physical activity has all of those benefits.
How is weight control a factor in managing diabetes?
Well, all of the research shows that when someone is overweight, and that's what we call a body mass index or BMI over 25, so generally 5 to 10% above their ideal body weight, that there is a glucose intolerance, again at every little cell, glucose intolerance when someone is overweight. So they run a higher blood glucose level for anyone overweight. So that is one of the most important parts of the meal plan or diet portion, and physical activity is for someone to lose weight.
Now, I'm sure we could spend an entire show on weight management, but what are the basics?
Basics are portion control, so healthy eating of the right kinds of foods, fruits and vegetables, and low-fat dairy, lean meats, avoiding sausage, hot dogs, those fried foods, fried items, those that are very high in calorie, and focusing on the low-calorie fruits and vegetables, as well as the physical activity. And my patients ask, how much physical activity? Most of them have none. And I'll say, of course, they have to be cleared by their physician if they have been inactive to make sure that they don't have heart disease or some other problem that would prevent them from beginning an exercise program. But the recommendation, if you're trying to lose weight, is 60 to 90 minutes a day, 5 times a week. So patients say, oh my gosh, where am I going to find an hour and a half to do that? And I tell them, break it down into 10-minute segments. Can you walk for 10 minutes around your house in the morning, up and down the stairs? Can you do 15 minutes at lunchtime? Can you do another half an hour when you get out of work? And depending on the weather, of course, is it inside or outside? But walking is the very best physical activity. So those are the important parts of weight management and a program to sustain a weight loss. We don't want someone to lose 10, 15 pounds and be on a crazy diet and exercise like a maniac and then stop everything and put the weight back on. We teach them how to change their lifestyle for the long haul.
Some patients may need medication or, as I've heard, a sugar pill. Can you explain how the oral medications work to help manage diabetes?
Medications are a myriad that are available for a physician to prescribe now. Years ago, we only had one type of oral pill or sugar pill that would stimulate the pancreas. That is the organ that produces insulin. So that was the only type of medication. Now the physician has medications that decrease the absorption rate of carbohydrate in the intestine, which slows the rise in the blood sugar. They have those that affect hepatic or liver production of sugar by hormones. They have ways to increase the sensitivity of insulin in the body. So many different types of medications that a physician can order. And then, of course, in addition to that, if the medications, diet, exercise don't control the blood glucose levels, then insulin is prescribed.
At what point does a patient need insulin injections to manage their diabetes?
Well, the physician will continually look at that hemoglobin A1C, the target blood glucose levels through the day, and if the patient can't get those under control with the lifestyle changes, which should be started first, the first 3 to 6 months, that's what a patient should say, I'm going to get out and walk, I'm going to eat properly, I'm going to lose weight. Even a 5 to 10% weight loss alone will start to bring that blood glucose level down. But if after those attempts the pancreas still isn't producing enough insulin, and these are for type 2 diabetes patients, then the physician will prescribe insulin. Now for type 1 diabetes patients, they don't produce any insulin, or very, very little during what's called the honeymoon phase. They have to have insulin. Oral medications wouldn't work for them. But for type 2, it's at the point where that blood glucose isn't down below those target values.
Are there different types of insulin?
Yep, and again, with all of the research and development of the types of insulin, the doctor again has a greater variety and a better way to help the patient manage their blood glucose level. Regular insulin is an old kind of insulin that's been around for a long time. There is also rapid-acting insulin, which is a type where we say to the patient, make sure you're sitting down, ready to eat your meal before you give your shot, because the rapid-acting insulins get into the system very quickly. It's Novolog, Humalog are some of the terms that patients would hear, and that controls the blood sugar right at the meal. There are also basal insulins. Lantus would be one, Levemir, where it works at a steady state for a 24-hour period. And that, along with the mealtime rapid-acting insulins, help control blood glucose. There is also the old standby NPH, which is an intermediate insulin, and some patients prefer not to give themselves multiple shots through the day, and the physician will order an NPH along with the other medications if necessary. And then there is also, there are other injectable medications that are not insulin that work in different ways in the body that help control the blood glucose as well.
Can we summarize the main concepts of diabetes management?
We can, and we can go back to the triangle of management. So the most important components to get that blood glucose level to target are proper diet or meal planning with carbohydrate control, physical activity, minimally 30 minutes a day, 5 times a week, and medications when necessary. And then the blood glucose monitoring to find out, are you in fact managing the diabetes properly?
That's all the time we have for today. For more information on diabetes management, you can go to www.ogh.org. And we'll see you next time on Health Talk.